With respect to IVDE and the use of NSAIDs, do you have an NSAID of choice or one that you would recommend one over another?
I don't necessarily have an NSAID of choice per se. I'd say if we're in a situation where we're going to need to change them over, like in some cases, we'll need to change them over from an NSAID to a steroid, like if they've got a lot of nerve root inflammation and things like that. I worry a little bit about like Deramax and Previcox and things like that. I think they can be a lot more likely to cause GI ulceration. So Galliprant's probably the safest from that respect, that you need less of a washout period in between. Most of the time, if we have them and they've only been on an NSAID for a short period of time and we need to change them over, we just cover them with GI protectants. But the problem with steroids is the flip side too, is it can make it like a little bit more difficult to diagnose other things because they like make a lot of other things better. But yeah, I mean, I think if they've been on Galliprant, we get a lot of dogs that have been on Rimadyl, as well. And even if we have to change them over, it's usually okay. But the hard ones are if they're been on Rimadyl for like 4 to 6 weeks, by the time that you see them and need to change them over.
Okay. And with respect to the NMDA antagonists, how long do they typically take to show an effect? And what's your recommended protocol usually for these?
Yeah. So usually for amantadine and memantine, I usually tell people it can't even take a couple weeks for it to be fully effective. And this is just kind of anecdotally what people will report. I'll usually use doses of amantadine of like 5 mg per kg BID, so a little bit higher. Some people will use SID dosing. The range is like 3 to 5 mg per kg BID, and I tend to go in the upper end of that range. On the flip side of that would be ketamine. So if we have animals that are we're really worried about wind-up pain, using sub-Q ketamine, or we definitely have them on IV ketamine pretty frequently after surgery to help with that wind-up pain. Memantine, usually I'll use doses of like 0.3 mg per kg SID to BID, But I've oftentimes found that the GABA analogs tend to work better. Like if they're really for us to add, and the other ones people are like, oh, that seemed to have made a huge difference. It's ketamine, I think, is a little bit different. It just works faster, But for the other ones, I tend to use them more for chronic nerve root compression or spinal cord compression if they've got more chronic discs. So.
And they can stay on it for life?
Mm-hmm. Mm-hmm.